Hey, hello there. Good afternoon. I'm Kian Laguar Bernardino, and I'll be discussing three healthcare settings. So, to start, I'll start talking about a hospital. So, a hospital is the most common place to go to. It's where, of course, they provide treatment and yeah, care services to patients who require a lot of immediate care, especially to those who have critical injuries and health conditions. Like most of the time, when you think about it, if someone uh, was pregnant and they're giving birth, you'd always find them at a hospital. Or if someone is critically unwell, that's where they'd usually go. That's actually most of the time they would go to, and when you go there, uh, you could notice that it's more crowded most of the time. There's a lot of patients, and that's the place where they they need to stay when they require a lot of care, or if they need to stay there long term for like a long time, few days, weeks, or months. And when I'm talking about a hospital, it would look something like this.
With her recovery in mind. All private patient rooms, built with his family in mind. And the area's only pediatric emergency department, built with his dreams in mind. To build a hospital this big, you need a foundation this strong. The new Stamford Hospital is now open. Stamford Health, healing reimagined.
Okay, so for number two would be the clinic. So, clinic is pretty much similar to the hospital, but it is much less crowded and doesn't have the extra services like a hospital does, or what a hospital provides. It has less equipment, and yeah, there's less people, and oh yeah, it is much more suitable for like having a daily checkup or a weekly routine when you need to check your condition. It's much like that. It's almost like a hospital, but of course much more smaller, and it doesn't have the it doesn't doesn't require patients to stay there much longer like a hospital where they stay there for a day or two. The checkups take at least either an hour or 30 minutes. So here's an example.
At Sansom Clinic Urgent Care, our fast track service means quick access to our team of medical experts, highly trained in specialties like emergency, internal, family, and sports medicine. We offer advanced imaging, infusion therapies, a lab, and a pharmacy. Telehealth video visits you can do from home. Walk-in visits with no appointment, 7 days a week. Use our app to check wait times before you arrive. When it matters most, choose Sansom Clinic Urgent Care.
Okay, number three. Lastly, number three is hospice. So, for hospice, I'd say it's pretty much like a home for the elderly, because it focuses more on the quality of life for people and also the caregivers who experience life-limited illness. So, with that setting, they show more compassion and provide more care for those who are ill, and for their patients, they just try to give them uh, much more joy and happiness as much as they can, because of course they are gonna live in their final moments, so as much as possible, they'd want to live their lives peacefully and happily. So that's all I have much to say for hospice. So here's what my example of hospice would be.
Applegate Home Care and Hospice has provided quality in-home care for over 20 years. We know it's difficult to face surgery, rehabilitation, and end-of-life care. You can trust Applegate Home Care and Hospice to provide your loved one with the personalized care they deserve. As a locally owned company, we understand the importance of family, and we have caring and dedicated nurses who come to your home to assist with your healthcare needs. Call us today for free information, 800-871-0102. Live today. Applegate Home Care and Hospice.